epidemic that naturally the body cannot defeat. For the most part, chronic conditions are not contagious. Chronic diseases can often be controlled but never cured. These epidemics are categorized as lasting longer than 3 months and can be treated but never cured by medications or vaccines. The most well-known chronic diseases consist of heart disease, strokes, cancer, arthritis, diabetes, and obesity. Chronic conditions often start at a young age and last a lifetime. Dr. Martin refers children with a chronic condition often don't realize what's different about them till an older age.
As many as 10% of children have a chronic illness that may interfere with their daily lives and activities, and those may range from things like asthma, which may not be apparent on most days, to more devastating illness like what Timothy Wagner has, muscular dystrophy.
Being treated for a chronic condition at any age can consist of a doctor's visit each week or only a couple times a month. Also, therapy is an option for anyone with a chronic condition. Chronic conditions are stressful and exhausting for both the patients and the families. A patient living with a chronic condition can last anywhere from 3 months to several years. Chronic conditions diagnosed in children tend to last longer than adults with a chronic condition. Children's immune systems tend to be weaker, so the medications to control pain and symptoms often don't work.
In the interim, dealing with Timothy's illness is virtually a full-time job.
Some days it's really stressful. Some days I feel like I just drive him from place to place and wait.
You ready to get out? Oh, no!
Luckily, at 4 years old, Timmy still rolls with the punches.
Actually, he loves to go to the clinic. He thinks that's a great fun. In fact, he thinks everybody should go to therapy. He's been going to physical therapy and occupational therapy since he's 18 months old. He doesn't know anything different.
Squeeze it just like the scissors we used, Tim. Squeeze.
Deciding what and how much to tell a child about his or another family member's illness can be an additional source of stress for parents.
Often physical therapy is the only option for children. When visiting Research Concierge, I learned that doctors do everything possible to make patients and their families comfortable. Although doctors, patients, and families of patients are hoping for a cure, one may never be found. Till then, patients are forced to learn how to manage the condition on their own.